Tonight, a report by the Ethics and Anti-Corruption Commission on examination of systems, policies, procedures and practices at the National Health Insurance Fund has revealed massive irregularities that led to the loss of millions of shillings of taxpayers' monies. Speaking during the handover report by the EACC to the Social Health Authority, the EACC chair, David Oginde, said the anti-graft body is pursuing senior NHIF officials implicated in graft, with Principal Secretary for Medical Services, Harry Kimtai, announcing that all NHIF staff will undergo a comprehensive vetting before being incorporated into the Social Health Authority, a move that is aimed at weeding out corrupt public servants. Seth Olale highlights the rot in NHIF perpetrated by corrupt government officers and health facilities.
A systemic weakness at the National Health Insurance Fund enabled corrupt officials to collaborate with a section of healthcare providers to swindle millions of shillings from the fund. According to a report by the Ethics and Anti-Corruption Commission into the examination of systems, policies, procedures and practices at the National Health Insurance Fund, system audit logs revealed numerous third-party, unauthorized access leading to additional unauthorized services to healthcare providers. For instance, 3 NHIF staff irregularly amended member details, occasioning a loss of 29.9 million to the fund on 14th July 2022. In addition, 12 specialized services were added to one healthcare provider. Privileged transactions were carried out by unauthorized users in the e-claim system, assignment and withdrawal of first-in, first-out formula, override rights, adding and removing of service codes to healthcare providers' facilities. Other malpractices include amendment to members and healthcare provider data, processing of transactions without approval workflows, failure to promptly migrate user system profiles for transferred staff, and sharing of system access credentials between staff and interns.
Any resources that were stolen from or through NHIF will be pursued until they are brought back or the people who are involved are brought to book.
And the whole purpose is not to transfer that is wrong into the Social Health Authority.
Timelines for healthcare providers contracting for various packages were not defined. Applications took 18, 20 and 50 months to receive approval for appointment to the fund's panel of providers. Reconstructing process was costly and laborious. Public healthcare providers were not assessed for recontracting. For example, Runenge's Level 4 was not assessed for this purpose. Some HCPs operated without valid contracts due to delays in processing contracts, e.g. Nakuru and Embu Level 5. Mechanism for tracking status of contracts had not been instituted. For example, in Kenyatta University Teaching and Referral Hospital, which had CyberKnife for cancer patients, which took a lot of time to include in the contract. Principal Secretary for Medical Services, Harry Kimtai, has announced that all NHIF staff will undergo comprehensive vetting before being incorporated into the Social Health Authority, a move aimed at weeding out corrupt public servants.
And we want to make sure that the operations of Social Health Authority that you're going to put in place are going to support and to ensure that there is no more fraud in the claims, a challenge that NHIF has faced for a long, long time.
So we have to be able to enhance our fraud detection systems and fraud prevention systems. That's why this report comes at a very opportune time for us, because it helps us to be able to modify any systems that we are designing at this stage to make sure that we don't have the kind of loopholes that have been described in the report today.
Even as the management of the Social Health Authority promises to fully implement the recommendations of the EACC as detailed in its report, concerns are being raised whether the pending issues will be fully resolved in order to exude public confidence. Seth Olale, Citizen TV, NHIF Building, Nairobi County.